All right, so thanks so much for inviting me to come speak with you all this morning. I am a naturopathic doctor and acupuncturist, like Dr. Kiefer had shared, and I've been practicing in southern Wisconsin for 16 years. I have a private practice in Evansville, which is a small town just about 20 miles south of Madison. I've looked forward to this day ever since returning to Wisconsin in 2006 after finishing my naturopathic medical school training in Oregon. I truly believe that when we collaborate in healthcare and understand and appreciate the unique gifts we bring to the clinical setting, we can provide the best in patient-centered care. My intention today is to help you understand and appreciate the field and practice of naturopathic medicine. So the goals today in my presentation are to share with you again about what naturopathic medicine is, but also about how NDs are trained, and what is the scope of an ND, and then with our recent licensure, how does that affect the practice of an ND? And then lastly, clinically, how is naturopathic medicine applied? Naturopathic medicine is a distinct system of primary health care that respects the unique health history of each person. Naturopathic medicine concentrates on whole person wellness, attempting to find the underlying cause rather than focusing solely on symptomatic treatment. Naturopathic medicine is an art, science, diagnosis, treatment, and prevention of disease using the most effective naturopathic therapies possible, really emphasizing prevention and self-healing processes through the use of natural medicines, and we'll get into that a little bit more. Naturopathic medicine itself was first defined in 1896 by Dr. Benedict Lust, although principles of naturopathic medicine date way further back into the Egyptians and Greeks. This is a picture here of Dr. Benedict Lust. When we look into the history of naturopathic medicine in America, we can see how the profession has evolved into one based more in science. Benedict Lust was born in Germany in 1872. And in his youth, he contracted a severe case of tuberculosis that wasn't getting any better with conventional treatments. So he underwent water cure treatments with the famous Father Kneipp. And within a very short period of time, his health improved. He then immigrated to the US to become Father Kneipp's official Wasserkur, or water cure representative. In the late 1800s, upon getting his training here in the US, he graduated from 3 medical colleges in New York, one osteopathic college, a naturopathic college, and a medical college. In 1901, Dr. Lust then opened the American School of Naturopathy. This was the first naturopathic medical school in the United States. He opened it in Manhattan and then went on to establish several health resorts on the East Coast. The health resorts provided an environment and experience for people that facilitated healing and convalescence in nature, providing fresh air, rest, clean water, fresh food. These centers often had natural hot springs for people to soak in, and a variety of hydrotherapy treatments were applied to different conditions. It was observed that when a person has a healthy, natural external milieu coupled with a healthy internal milieu, healing occurs. This became a fundamental precept in naturopathic medicine. Naturopathy grew in popularity and then started to fragment, both from internal debate within the profession, but also political pressure. So in 1910, the Flexner Report was published, and the intention of the Flexner Report was really to establish biomedical sciences as foundations for medical school. But unfortunately, this resulted in the elimination of more eclectic schools. The Flexner Report created standards of education and accreditation for medical school, but 1/3 of American medical schools were eliminated due to substandard curriculum, including many of the medical naturopathic colleges, including the American School of Naturopathy was one of these that was closed. By the mid-20th century, the field of naturopathic medicine in America had all but died out. There was a small handful of naturopathic doctors in the country continuing to care for patients. And these doctors banded together to start the National College of Naturopathic Medicine in 1956, which is my alma mater, and began to build the next generation of naturopathic doctors. 1970s started to see a resurgence and growth into modern naturopathic medicine. Modern naturopathic medicine is more grounded fundamentally in science. In 1985, the American Association of Naturopathic Physicians was established, and this really established the profession in a federal and national way. The AANP is very much involved in creating standards of education for naturopathic doctors, as well as accreditation for schools. The AANP also created standards of ND practice and really codified the philosophy of naturopathic medicine. So you're probably wondering, how are naturopathic doctors trained? Naturopathic doctors training is somewhat similar to a medical doctor or a nurse practitioner or a DO, in that we have pre-med requirements. A 4-year undergraduate degree is required to be able to matriculate into a naturopathic medical school. And then naturopathic medical school is a 4 to 5 year graduate in resident medical school, conferring the degree of doctorate of naturopathic medicine. These schools are federally accredited by the U.S. Department of Education, and there are 5 such schools in the U.S. and 2 in Canada. Graduates of naturopathic medical school then take board exams, national board exams, and in order to be eligible for licensure in all states that license naturopathic doctors, you must be a graduate of an accredited school, as well as successfully completed the national board exams. Curriculum of an ND, we take the same basic and clinical sciences as other medical professionals, also understanding pathophysiology and diagnosis of disease in the same way, studying the same biomedical sciences. Our education, though, it starts to incorporate natural, non-toxic treatments with an emphasis on disease prevention and optimizing wellness. Our clinical education is incorporated into the curriculum for 3 years of those 4 to 5 years of school. And this includes preceptorship, and it also includes clinical training of on-site patient care in various settings. Residencies at this point are not required for naturopathic doctors. They are very much in demand by graduates, but they are limited. There is not federal funding for naturopathic doctorate residencies at this time, so they are all privately funded. To give you an example, in 2022, just this year, there were 421 resident applicants and for 91 sites. So there are many people that graduate that want to have a residency, but again, because they're privately funded, they are limited. That's an area that in the future we really need to improve. Oftentimes people will go on and specialize with education after their naturopathic doctorate schooling. There are specializations in oncology, there are specializations in pediatrics and in endocrinology, and each one of these additional credentials requires, again, additional examinations, often residencies within that field. They've got their own standards there. So you're probably wondering, where are these schools? A lot of them are on the West Coast. So my school there is at the National University of Natural Medicine, Portland. Where Dr. Kiefer worked and taught was at the Bastyr University in Seattle. Bastyr University now also has an additional campus in San Diego. There is also a school in Phoenix, Arizona, which was called the Southwest Naturopathic Medical School, recently changed its name to Sonoran University of Health Sciences. And then the only one that we have in the Midwest is here in Chicago. It's in Lombard, the National University of Health Sciences. This is the most, I'd say it's the youngest. I think that they've had maybe 6 or 7 graduating classes. So I think they've been, their program's been going for about 15 years. And we're starting to see some of these graduates wanting to set up practice in the Midwest, which is great. And then you can, of course, see the two Canadian schools there. So we'll get in a little bit into the principles of naturopathic medicine and share a bit more about how a naturopathic doctor, thinks when they're approaching a case. Okay, and we'll get into that a little bit in the towards the end of the presentation today. But we always are guided by these same principles. These would probably look very familiar to you. Probably things that you already do yourself in your practice, but treating the whole person, really, treating body, mind, spirit, recognizing that healing comes in all forms, and all of those levels are really important for whole person healing. First, do no harm. This particular element really in naturopathic medicine is more about using the least invasive and safest methods possible, and first, if we can, rather than going to a more a treatment that may have higher risk. Doctor is teacher, so naturopathic doctors, we spend a lot of time with our patients and really want to not only empower them, but also help them understand the impacts of their living and their decisions, and help them understand how they can live in a way that actually facilitates their healing and health. Identify and treat the cause. So again, treating the symptoms is a very important thing to relieve suffering immediately. However, we never want to lose sight of the fact that there may be some underlying causes going on that also need to be addressed. Stimulating the healing power of nature. So this is, as naturopathic doctors, is something we're always trying to do. And like I had shared, sort of as this fundamental precept from Dr. Lust, a lot of that is about living a healthier lifestyle, right? So that we can, again, have that healthy external milieu and healthy internal milieu really creates the environment for healing to take place. And then lastly, prevention. We focus a lot on, not only how the person got to where they are in their health or illness now, but also how can we prevent this from reoccurring. So the tools of a naturopathic doctor, we do a lot of diet, so a lot of clinical nutrition work. Really understanding food is absolutely fundamental to a person's health. Physical medicine, so this can be something like exercise, but it can also be a little bit more type exercise therapeutics or physical therapy type work, and even naturopathic manipulation techniques that we're trained in. Botanical medicine, herbal medicine, homeopathic medicine, psychology. We do a lot of counseling and psychology lifestyle work in our practices. Some of us have the legal ability to prescribe pharmaceuticals depending on the state's scope, and we are trained in pharmaceuticals as well as drug nutrient interactions. And then lastly, minor surgery. Let's see, I'll tell you a little bit about what an ND's practice looks like. Okay, so a lot of people wonder, right? Are there NDs that are practicing in group settings? Are they in research? Are they writing? What are NDs doing? And you can see here from some of the this study that came from the 2020 Graduate Success and Compensation Study, that most naturopathic doctors are practicing in a solo private practice. And then secondly, group private practice, really in that private practice model. Some are involved more in university, college programs, And then you can see there that also in the natural products industry, nonprofits, you can see that, there's sort of a diversity of practices or job opportunities for NDs. You can see here that these numbers don't add up to 100%. So just to make a note that a lot of NDs, their practices their jobs are diverse, where they may have a private practice, but then maybe they write on the side, or maybe they are involved in research or something in addition. NDs are trained to practice primary care. So we are trained to diagnose and treat acute patients. We know when to refer to other providers. The primary care practice can be limited depending on the state's scope of practice, and we'll get into that in a little bit. Typical ND patient is a person with a chronic health issue, and tends to be people who are, again, probably a lot of the people that you're seeing, they're sort of at the end of their line with conventional medicine. Either they don't tolerate the treatments, they have side effects, or they don't want the treatments, and they're looking for what else can I do. And these people, though, naturopathic doctors, we ask them we give them homework. They do need to be motivated to be able to, sorry, I just realized that I'm on the other slide and you guys aren't. I'm sorry about that. Oh my goodness, I can see both on my screen. It totally distracted me. So sorry, this is where I am. Now here you are. So again, a typical ND patient tends to be really motivated with self-care lifestyle changes, and they need to be in order to be successful with naturopathic medicine. So in ND's practice, typically areas of focus include digestive, GI issues, people coming to us for nutritional work, and then mind, body health, and insomnia, pain. These tend to be the areas of a naturopathic doctor's practice. And because I skipped ahead, guys, if you bear with me here, I wanted to point out some things on the previous slide. All right. So on the right-hand side, I just wanted to share with you, a lot of people wonder, what are these cash-based practices? So 57% of NDs, their practices are cash-based, 40% combination of cash and insurance, and 3% are insurance only. So that's, again, we'll get into that's a combination of things. A lot of that has to do with licensure and insurance companies covering naturopathic medicine. Typically, a naturopathic doctor will see anywhere between 20 to 39 patients per week. And typically, a 44-hour work week is pretty common. All right. So it's a good segue into what does an ND's appointment look like, right? So when a patient comes to see an ND for the first time, the first visit is typically 60 to 120 minutes, and includes a thorough history, pertinent physical exam, creating an individualized plan of action is the goal by the end of that first visit. And depending on the scope, the ND may draw blood, order imaging, apply physical medicine, IV therapy, minor surgery, again, depending on the scope, and we'll get into the scope in a bit here. Return visits tend to be 30 to 60 minutes, depending on complexity for the patient's condition. And NDs do everything that other medical providers do. So we write SOAP notes, we have EMR systems, we follow the same HIPAA rules as any other medical provider. Fundamentally, NDs are trained to be collaborative with other providers. It's not a black or white, see an ND or see an MD. It's really, oftentimes people will have both, and I encourage people to have both to, again, use the gifts of all of the different providers. NDs are also, we refer to specialists when we need to. We are trained, again, to recognize when it's things are out of our scope and the person needs additional care. Again, cost is primarily out of pocket, and the cost of an ND visit is anywhere from $100 to $400 per hour. I know that's a pretty big range, but a lot of that depends on the experience that the ND has had, how long they've been in practice, as well as any kind of specialization that they may do. Some NDs may have concierge or membership packages. We're starting to see this in a lot of different realms of functional medicine, integrative medicine. People in private practice are choosing to do this, and patients will pay monthly or annually for their care. So where are NDs licensed? We have got, just a minute. Okay. So you can see here that looking at the map, that the dark green and the light green, those are the licensed states, okay? And you can see that a lot of them are clustered around the West. We've got a few in the Midwest, and then we've got some further up into the Northeast. The dark green, there are 22 states total that license naturopathic doctors, and 3 territories and districts, including Washington, D.C., Puerto Rico, and the U.S. Virgin Islands. The dark green here this is where NDs are licensed, and there's some degree of insurance coverage for ND services is available in those states. So again, you can take a look and see. Those tend to be the states that have had licensure established for a long time, right? So the year listed on this map under each state's initials is the year that it's been licensed. So Washington was 1919. And there are thousands of naturopathic doctors that practice in Washington, and insurance is the norm rather than the unusual situation. It's insurance coverage for naturopathic services. Oregon, 1927, it was licensed, and then Arizona, 1935 was licensed, right? So some of these states have been licensed for a very long time. And then when you look at the Midwest, you can see that Minnesota was licensed in 2008. There's no insurance coverage there. Kansas, kind of the Midwest, licensed in 2003. North Dakota, 2011, and then Wisconsin, like Dr. Kiefer was just saying, we achieved licensure this year. And then you can see here too, the pink are bills that were filed or pending in 2022. So our Midwestern neighbors, this is all happening, right? Like the licensure and the movement towards licensure is happening really throughout the country. Some of these areas that are gray really just don't have very many naturopathic doctors practicing there, so there's just no action forward. To give you an idea about how many naturopathic doctors practice in the country, there are about 6,000 practicing in the U.S., and in Wisconsin alone, there are 30. So, and the reason that that's so low is because practicing in a state that doesn't have licensure is very unattractive to any new graduates, and I'm sure you can understand that. And we'll talk a bit, move right back into the benefits of licensure. Oh, there we go. Okay, so why do we want licensure for naturopathic medicine? Licensure fundamentally creates educational standards for naturopathic doctors. You saw the education that naturopathic doctors get and how critical it is that naturopathic doctors are able to practice to their scope and to their training. And creating educational standards is the fundamental piece of licensure that really distinguishes a naturopathic doctor from anybody else who might hang out their shingle and just say, hey, I practice natural medicine, right? So only NDs that have graduated from federally accredited programs are eligible for licensure. They also have to have passed national board exams. Most states also have state jurisprudence exams for licensure. Licensure also ensures that NDs maintain continuing education, annual continuing education. Licensure also protects the title of ND. Again, only those that are licensed can use that title. And this allows you too, as providers, to understand how a person is trained, right? So if somebody calls themselves a naturopathic doctor in the state of Wisconsin, now that we have licensure, if somebody calls themselves that, you know, oh, this person is trained to this level, okay? And this is their scope, and this is how they can help my patient, okay? It also protects the public in that way. It helps the providers, but also very much protects the public, because licensure creates a system for governmental oversight, right? So we have now we have recourse. If patients have issues with a provider, they actually can go to the state, make a report, and there's recourse for patient claims. As a provider, also, naturopathic doctors are eligible for medical malpractice protection. Without licensure, we were not eligible for medical malpractice insurance. Licensure also enforces the ethical standards of practice for naturopathic doctors. And again, this is done through the board, through the state board. Licensure also, because we're trained as primary care providers, especially in rural areas, this is going to help fulfill the need for primary care providers. Again, there will be an increase. Now, I know I shared there's only 30 of us in the state of Wisconsin, but what we see with licensure is that there is a significant increase. There are a lot more graduates that want to come to the state. Makes sense, to set up their practice and to be able to start helping people. So there will also be really an increased number of naturopathic doctors in the state, as well as, then access and helping people. And again, fundamentally, we're collaborative with other providers, and we can really see that licensure really helps improve patient outcomes. So what is an ND's scope of practice? So all licensed states allow NDs to diagnose and treat disease, give nutritional recommendations, give lifestyle recommendations, use botanical medicine, use homeopathic medicine, and use some form of physical medicine. And some licensed states, and I wrote on here how many of those states, also allow NDs to order lab tests and imaging. So that's in most licensed states, so 21 states. Draw blood, 17 states. Primary care status, that's just basically how the bill is written, it's 12 states. Prescribing rights in 13 states, and 9 states have prescribing rights for controlled substances. 12 states have IV therapy and injectables in their scope, and then 14 states have minor surgery in their scope. So in March of 2022, Governor Evers signed our bill into law, which is awesome. I've been working on it for, it feels like forever, but over a decade. So we had a great team of naturopathic doctors that really worked really hard to get this done. And this is actually also just like the first step of many. So when you're establishing a medical profession legally in a state, it's a lot of work. So we've reached this mountain, and then you can sort of look at the top. You're at the top of the mountain. You look out and you see the next highest peak, right? That's kind of how I feel. So at this point, this is our law. It's called 2021 Wisconsin Act 130, and our law will not be fully enacted, and NDs cannot apply for licensure until at least 2024. So, and that is because at this point, the Naturopathic Medical Examining Board needs to create the rules and regulations along with DSPS to actually fully establish the profession. And then at that point, people can apply. So our law, Wisconsin Act 130, details educational requirements of an ND, as I had previously stated. It also creates requirements for NDs to complete continuing education, jurisprudence and pharmacology exams, and carry malpractice insurance. The law also defines the scope of practice for an ND, which I'll describe in the next slide. It also protects the title ND and the words naturopathic medicine. It establishes a 7-member naturopathic medical examining board. That board is made up of 1 medical doctor, 2 public members, and 4 naturopathic doctors. The Naturopathic Medical Examining Board will then enforce disciplinary proceedings and actions, and all of the details of that are defined within our law. So the scope of practice for NDs in Wisconsin, what does it look like? So in Wisconsin, we have we practice as primary care provider, which basically just means that we are the first stopping point for our first entry point for a patient for when they have healthcare needs, and that we know how to refer safely, we know how to diagnose and treat, and refer, get the person basically into the system, into the healthcare system, get them the care that they need. We are able to diagnose and treat disease. We are able to perform physical exams, order labs and imaging, perform ultrasound, ECG in office, phlebotomy, so we can draw blood, and then perform minor office procedures. Health education, so again, lifestyle counseling is a big part of our practice. Nutritional recommendations, including vitamins, botanicals, homeopathics, naturopathic physical medicine, including hot or cold therapy and exercise, and then allowed to recommend devices, including therapeutic devices, barrier contraception, and recommend and administer OTC drug products. Naturopathic doctors cannot, in Wisconsin, perform any surgical procedure other than a minor office procedure. So this specifically refers to no surgery to extend to eye, ear, tendon, nerve, vein, or arteries. Minor surgery procedure refers only to the superficial tissue. So stitching a cut, okay, stitching a superficial wound. No general or spinal anesthetics, no ionizing radioactive substances, no chiropractic manipulation, and that's specifically using the language chiropractic. So, and that was something that we had to make sure that our bill did not say, and it was part of our negotiations with the Chiropractic Association. So we do some physical medicine, hydrotherapy, massage type techniques, but no chiropractic manipulation. And then no pharmaceutical prescribing. So I want to share with you a little bit about what it looks like to sort of think like an ND and how an ND will approach a patient. We use something called the therapeutic order. And the therapeutic order is a set of guidelines for clinical decision-making that prioritizes minimally invasive therapies to support the body to repair itself. Because of this, NDs lead with natural treatments. However, we're also trained to use pharmaceutical drugs when necessary, if that's within our scope. We can prescribe medications if our state license permits, but if not, we'll refer patients to and collaborate with the prescribing medical provider. Naturopathic doctors will help balance potential unwanted side effects of these medications with natural protocols that can correct them. And the goal is to reduce or eliminate reliance on medications in the long term by addressing the root causes of the disease. With that said, I always tell my patients I cannot change the medication that was prescribed by another provider. And so again, this is where the collaboration comes in. If the patient comes in and they say, hey, I want to get off my omeprazole, then I say, okay, hang on, let's make sure that you're in conversation and communication with your medical doctor about this before, and make sure that they understand, the prescribing physician understands what you're doing, okay? So let's take a look a little bit closer at this therapeutic order. I'm going to go ahead and show you a little bit about how this is applied. So in mild to moderate asthma, we know that asthma is super important, that a person has a prescribing physician on board with them in case they need their rescue inhaler, if they need other pharmaceuticals. And as a naturopath, we are looking at how can we remove obstacles to health? What are those obstacles to health for a person? Do they have poor air quality? Do they have an environmental allergy? Is there something in their diet that's exacerbating their situation? Is stress or anxiety contributing? And by removing these obstacles, we start to already, again, improve the external and internal milieu and stimulate self-healing mechanisms. We want always, as naturopathic doctors, we're always thinking about how is this person's lifestyle contributing to their condition. So to stimulate self-healing, making sure that they're getting quality sleep, so important. Making sure that they have stress management going on and that they're doing some of these excellent, I loved hearing about the mind-body workshops and classes. You guys are doing such great work there that's so critical and so important for people. And then also making sure that their diet is rich in fruits and vegetables, antioxidants to help them heal. When we look at strengthening weakened systems, the third principle in the therapeutic order, we want to encourage exercise, encourage their stamina, evaluate. We also want to evaluate for any nutritional deficiencies. Are they deficient in vitamin D, other nutritional deficiencies that may be contributing? And what's their overall immune system like? How do they catch everything that goes by, that comes into the office or that their kids bring home? Or do they tend to be pretty strong and healthy that way? We also look at what's going on in the other systems that might be contributing. Are there, how's their GI health? How is that contributing? How's their microbiome? How's that contributing to inflammation? How's that contributing to their overall ability to be healthy? And then again, that fourth principle is restore and regenerate. So, really looking at what are we needing? What's the body needing to be able to restore and regenerate? So do we need specific antioxidants, things like NIC for the lungs, glutathione, or essential fatty acids, or probiotics, again, with health of the gut? And then again, that seventh piece of the therapeutic order is recognizing that we may need some pharmacological substances. And you can see in this, I'll go back to the sixth therapeutic order, we want to use pharmacological substances to halt the progression of the disease. We can do that using drugs, but we can also, even some natural medicines have a pharmacological effect. Some botanicals will have a pharmacological effect. And sometimes we need to use that level. It's another example. So mild to moderate hypertension. Again, we're thinking remove obstacles to health. What's getting in the way of this person's ability to heal, right? And so do they, so much lifestyle stuff, right? For this, for blood pressure. So are they exercising? Do they have stress, anxiety, anger, a lot of mood issues with hypertension? How's their diet? Are they sleeping? Are they smoking? Are they overweight? All of this lifestyle piece. And then through those lifestyle changes that we know take a lot of effort, again, and take a longer term to be able to see the benefits, but will set that person up for some fundamental health changes. That will start to stimulate their self-healing mechanisms and strengthen their systems, right? So which systems are weakened? Do they have other sources of inflammation going on? Do they have documented cardiovascular inflammation that we can track? They have dyslipidemia, right? What kind of nutrients do we want to look at to support healthy cardiovascular system? And that also, food is so important, right? And there's so many foods that are so critical for heart health, especially. So looking at, encouraging the Mediterranean diet, high antioxidant foods, oily fish and blueberries and all those good things. These are actually antihypertensive foods, and we've got data now to show that. And by using these antihypertensive foods, these foods really rich in these essential fatty acids and antioxidants, we can restore and regenerate some of the tissues that have been damaged by the hypertensive state, and really help to restore a normal, healthy endothelial function. And then again, recognizing that if a person needs it, antihypertensive medication, right? So mild to moderate hypertension tends to be something that naturopathic medicine can address really well. If somebody comes in with severe hypertension, I tell them immediately, you've got to be on a drug. You've got to be on a drug. No question about it. But mild to moderate, that's something we can usually work with, especially when they have these obstacles to health and they've got a lot of work that they can do and they're motivated. Then the naturopathic approach will make a big difference for them. So a lot of, I was sharing a bit about, who comes into the office. A lot of times we get people with fibromyalgia, chronic pain, sort of like mysterious conditions that, maybe aren't very well addressed by conventional medicine. There just aren't a lot of options for these people. And when they come in, we just really try to meet them where they're at and try to get really clear about what they can and can't do. So when we're looking at obstacles to cure for a person in chronic pain, some of these things might be really difficult to do, right? So if there's a long history of trauma, if there's a long history of childhood trauma or physical trauma contributing, that's a long healing journey. It's very possible, but it's a long healing journey, as you all know. Poor diet, certainly an inflammatory diet will really contribute to fibromyalgia. And oftentimes when you're in chronic pain, you just are not taking good care of yourself. It doesn't feel, you just don't have the motivation to do it. But there may be some things going on in their life too that they can't change. Maybe they're a single mom with multiple kids. Maybe they're in a abusive or stressful relationship. There are a lot of different things that we can't really change. And so again, we meet the person where they're at and help find out where they can change to improve some of the aspects of their health. And we usually will see their ability to cope and deal on a daily basis does improve. And so again, through this daily self-care and encouraging daily self-care, we're stimulating self-healing. We're strengthening weakened systems by improving exercise stamina. A lot of the patients I see have not only fibromyalgia, but a chronic fatigue type picture too. And so that exercise training is a big part of that. And when I say exercise, sometimes that means, just waking up and taking a shower, right? So some people are there. And again, you meet them where they're at. Stress adaptation. So most of the time, these people have got a chronic stress is a big piece of what's going on. So helping them adapt to stress by using practices, mindfulness practices, but also herbs and nutrients that can support the hypothalamus pituitary adrenal axis and really help them adapt to stress. And then also looking at, do they have nutrient deficiencies? Sometimes we'll do some testing for nutrient deficiencies and see. These people often will have fascial restrictions, an injury history. I really love myofascial release techniques. I don't do them myself, but I've got a massage therapist here in the office that does fantastic. That works so well for people with fibromyalgia. It's amazing. And again, when we can get them feeling a little bit better in their bodies, then they're going to be motivated to do more of the other changes that we're encouraging them to do. So restore and regenerate in something like fibromyalgia, we're looking to restore and regenerate the nervous system, the neuromuscular system, And then oftentimes there's an immune component especially if there's a chronic fatigue picture, there can be a chronic infection or an immune component also. So it starts to give you a little bit of an idea about how naturopathic doctors think. And you know, oftentimes I have patients that are hesitant to share with their primary that they're seeing an ND. And I always tell them, we have the same goal for you. We all want to provide care for you, and we all want to help you reach your optimal state of health. We just have different approaches, different tools, but we all have the same goal. And so I encourage them to share with their primary care provider about what we're doing. Share with them, tell them about what it is we're doing. What kind of homework do you have? How are you changing your lifestyle? Any supplements, nutrients that you might be on, please share. I want an open dialogue between the providers, and that's really what's best for the patient. So through this presentation, I'm hoping you have the knowledge now to discern who's a medically trained ND, and that you can trust that licensed NDs are trained to provide safe, sound, and quality care. Thank you. Lastly, I've got resources here for you. So to find licensed NDs within Wisconsin, that's the Wisconsin Naturopathic Doctors Association. Within the US, that's the American Association of Naturopathic Physicians. And then to learn more about the profession, I've listed there for you for further research for yourself. Thank you.